Thank you, Corinne. So President Biden says that we are not returning to lockdowns, shutdowns, and school closures, but he also once said that we didn't have to wear masks anymore once we were vaccinated. So why should Americans trust him now?
Well, because we listen to the scientists, we listen to the expert. This is a public health situation. This is not about politics at all. This is about saving lives. And this is what the president is all about. He wants to make sure that we are saving lives. If you look at, Peter, the last 6 months, that's what he's done every day. And you see that in the numbers. Now we're at a point where we have to double down and make it very, very clear to people that we can't let the pandemic win. We have to continue to fight.
So if you're listening to the science, if scientists come to you at some point down the line and say, it is our opinion that there should be shutdowns and there should be school closures, you would do that?
Well, we listen to, like I said, we listen to the CDC and the expert and their guidance. The CDC is a body that is very well respected, and we follow their guidance.
And after this new guidance came out, the head of the American Federation of Teachers, Randy Weingarten, came out to say we are going to try to open up schools. Is that good enough for the president, just trying?
Well, the president and the Secretary of Education has been very clear. By this fall, they want to see all schools open. They've been very clear about that the last 6 months. That's why in the historic American Rescue Plan that he signed into law in April, there are resources in that plan to make sure that schools are able to open up safely, that schools have the resources to have the PPE, to get that ventilation. And so the president had that in mind when he put together that plan and signed it.
But now that after the plan was out there, now after this new guidance, the teachers are saying they're just going to try. Is that okay?
Well, we're going to continue to work closely as we have with local governments, with the teachers, as we've done and continue to have those conversations. I want to add, though, that nearly 90% of teachers are currently vaccinated. That's a good sign. Now we just have to make sure we also protect our kids, right, in school. We protect the other administrators at school, people who are immunocompromised, and that's why the CDC put out that guidance, making sure that people are wearing masks in schools.
And last one, just because you talk about this administration having a priority of protecting the American people, can you help us understand why is it that the federal government is asking vaccinated Americans to wear masks to stop the spread of COVID-19, but at the same time, federal agents are also releasing COVID-19 positive border crossers into small towns in Texas? How is that?
Well, let's step back for a second, because this is okay, very interesting. I'm sure everything's fine.
Something I said?
It could be. But you did laugh at my joke, so maybe that's a reaction to laughing at my joke. Okay, so I just want to be very clear here. I do want to answer your question, Peter. First, just to step back and do this 30,000-foot view, there's been no change in Title 42. Families and single adults are expelled, if possible, when apprehended at the southern border. The majority of apprehensions that we saw at the border in June were expelled. Those who can't be expelled or are awaiting processing are often placed in alternatives to detention programs while their cases are being reviewed. CBP provides migrant with PPE from the moment they are taken into custody, and migrants are required to keep masks on at all times, including when they are transferred or in the process of being released. If anyone exhibits signs of illness in CBP custody, they are referred to local health systems for appropriate testing, diagnosis, isolation, and treatment. CBP takes its responsibility to prevent the spread of communicable diseases very, very seriously. We value our partners in local communities whose work is critical to moving individuals safely out of custody and through the appropriate immigration pathway, and assist in mitigating COVID-19 and isolating quarantine when needed. So that's what I have for you, Peter. Okay, thank you.
And that's all we're trying to do. Yes.
Mr. President, thank you. Why not push for vaccine mandates in states, private companies, schools? Do you want to see those entities pass vaccine mandates?
Well, I'd like to see them continue to move in that direction, and that's why I pointed out. I had asked the Justice Department to determine whether they're able to do that legally, and they can. Local communities can do that. Local businesses can do that. It's still a question whether the federal government can mandate the whole country. I don't know that yet.
Mr. President, you said earlier this week that we are not headed back towards lockdowns, but if the science is evolving, how can you be so confident in that? We heard you say weeks ago that the virus was on the run, but Dr. Fauci has also indicated that we are headed in the wrong direction.
Well, you're literally correct on everything you said, but it doesn't come to the conclusion you're implying. It is clear that if everybody's vaccinated, the existing vaccines work to prevent death, serious illness, hospitalization. Okay? If tomorrow I could wave a wand and every American was vaccinated, then in fact, we'd be out of the woods. Now, can something else happen a year from now? Can there be a different virus? Can there be something? It's possible. But I'm talking about COVID and the existing variants that have come forward so far. So it's a simple proposition. If you're vaccinated, you find yourself in a situation where you are highly unlikely, even if you somehow get the virus, very small percentage do, that you are not going to be hospitalized, you're not going to be on a ventilator, you're not going to be sick, but you could be in a position to possibly spread it to someone who wasn't if you have it in you. Yes.